As the Scott County Commissioners weigh the future of the county's syringe service program, advocates are boosting efforts to promote it. Mitch Legan reports.
Scott County is no longer a bad story. We've become a beacon of hope.
After slowing the severe HIV outbreak there, the clock is ticking on Scott County's syringe service program. 2 county commissioners have voiced their displeasure with the program. Mike Jones, who's voted twice to end it, and Randy Julian, who said late last week he planned on voting against the exchange in a since-deleted Facebook post.
The commissioners partnered with us 6 years ago. They remained partners with us over the last 6 years, and we invite them to continue to partner with us.
Healthcare, recovery workers, and concerned citizens gathered for a town hall Tuesday to educate and answer questions about the county's syringe service program.
You know, we can't let them know we know who they are, and we can't tell people who they are, because that's the law that we have to abide by.
Those against the program, like the 2 county commissioners, say it enables drug users, puts more needles on the street, and are frustrated it doesn't lead more people to recovery. Advocates say that takes time, and ending the program could have a catastrophic effect on the county, which had just 1 new case of HIV last year after seeing hundreds during the epidemic earlier in the decade.
Those 9 people in my family are still alive, thanks to the SSP.
A vote on the program's future is scheduled for June 2nd. For Indiana News Desk, I'm Mitch Legan.
My colleague Mitch Legan joins us. Mitch, you've been following this issues for a long time. Now, you touched on it in the story. How do things currently stand with the commissioners?
Yeah, so Scott County has 3 commissioners, Mike Jones, John Lisenby, and Randy Julian. Mike Jones has been the most outspoken critic of the syringe service program. As I said in the piece, he's voted against it twice. Now, on the other hand, John Lisenby, he likes the program. He was the only county commissioner to show up to the events this week. And then there's Randy Julian, who until the end of last week was seen as the swing vote. But then he took to Facebook in a since-deleted post and referred to the syringe service program as a welfare program for addicts. He said it was basically leading more people to use drugs and making the county look bad. So he's planning on voting against it when they meet next.
So what happens with the exchange if they do decide to end it?
Yep, so I actually got on the phone with Michelle Matern, the county health administrator, earlier this morning, and she says it's up in the air. The syringe service program is scheduled to end in May of next year. So this is kind of something the commissioners brought up themselves. They probably saw new HIV cases going down and figured, hey, it might be time to end this program. But if they do decide to end the program, they could cut it off right then and there, maybe phase it out a little bit, or wait until that May 2022 deadline. And I think it's worth mentioning that earlier this year at the State House, the state legislature actually voted to extend the statewide deadline for these programs until 2026. So at least at the state level, they feel this is something that should stick around.
Did Matern say anything as to what the effects might be if they do cancel the program?
Yep, so there was 1 case of HIV in the county last year, but there are still over 150 people living there with it. So unsurprisingly, she expects those numbers will go back up. But she was arguably almost more concerned about the message it might send to other exchanges across the state or even nation. We're seeing what's happening in West Virginia, where they just got rid of an exchange there. And Scott County's syringe service program is seen as the way to do it. So she's concerned about some of those ripple effects ending the program might have.
And Mitch, really quick, when's the next meeting?
Wednesday, June 2nd. John Lisenby told me he expects them to vote on the issue then.
All right, Mitch, thank you very much.
Thank you, Joe.